In addition to the COVID vaccine, 3 other very safe and effective vaccines protect you and your baby from dangerous diseases: influenza, tetanus, diphtheria, pertussis, also known as whooping cough, and respiratory syncytial virus, or RSV. Vaccines provide 3 important benefits. They can reduce your risk of infection. If you do get infected, vaccines can reduce your symptoms, so you won't get as sick. And if you vaccinate while you're pregnant, your baby will also receive disease-fighting antibodies, which helps protect them against these diseases during the first few months of life, when they are the most vulnerable. First, let's discuss the vaccine you already know: influenza, or flu vaccine. The flu vaccine reduces, but does not eliminate, your risk of getting infected with the influenza virus. Consider a vaccine like an umbrella in the rain. An umbrella can keep you dry, sometimes completely. But if it's raining very hard, an umbrella won't prevent you from getting hit by some rain. In the same way, the flu vaccine protects you from infection, but sometimes not completely. No vaccine is perfect. And like an umbrella that reduces how wet you get from the rain, a vaccine also reduces symptoms. You won't get as sick if you do get infected. Of course, because the flu virus changes so fast, we all need an updated flu vaccine every year. Women's bodies undergo many changes during pregnancy. Some of these changes leave pregnant women extra vulnerable to diseases like the flu. In fact, pregnant women are much more likely to have serious complications or die from the flu than women who are not pregnant. And getting the flu during pregnancy can also affect an unborn baby's growth and chances of premature delivery. Getting the flu vaccine during pregnancy provides protective antibodies to the unborn baby. Babies under the age of 2 are those most likely to have severe complications from the flu. In fact, more than a dozen infants in the United States die every year because of the flu. This could be prevented by the pregnant mom getting the flu vaccine. Now the downside of the flu vaccine, which you probably also know. Some people feel lousy after getting vaccinated, but that's not the flu. It's your body's immune system building protection against influenza. And those reactions disappear by themselves within a few days. Way better than getting the flu. It's also possible to get infected before the vaccine takes effect. And the vaccine works for many, but not for everyone. Are there serious life-threatening side effects from the flu vaccine? Yes, but they are extremely rare. How rare? Imagine a football stadium filled with 70,000 adults. If everyone in the stadium got the flu vaccine, it would take more than 5 completely filled stadiums of people for one person to have a serious side effect from the vaccine. Now, how does that compare to the risk of complications from flu disease? Imagine again just one stadium completely filled with 70,000 pregnant women, this time unvaccinated. In an average year, over 5,000 would get the flu. Of these, about 171 would end up in the hospital. But if all these pregnant women had been vaccinated, in an average year there would have been about 3,300 cases of flu and 102 hospitalizations. So flu vaccines protect most people most of the time. Because people who have had the flu in previous years can get it again, getting a flu vaccine every year helps provide protection. Now another vaccine recommended for all pregnant women: Tdap. Tdap stands for tetanus, diphtheria, and acellular pertussis, also known as whooping cough. All of these diseases are bad for you and bad for your baby, especially whooping cough, which can be fatal for babies. These 3 bacterial diseases used to be common and are much less so now because of vaccines, but they're still around, and whooping cough is making a comeback as outbreaks continue to occur, especially among unvaccinated people or those not up to date on pertussis vaccine. Cases of whooping cough have recently increased and are now more than 10 times as frequent than in the 1980s. Unfortunately, many of those cases are babies. Babies can't get fully protected from flu or whooping cough by their own vaccines right away. The protection you can give your baby during pregnancy is all they have for the first few months of life. So, by choosing to get the flu and Tdap vaccines while you're pregnant, you can help protect yourself and also help protect your newborn baby. And finally, one more vaccine available to pregnant women: respiratory syncytial virus, abbreviated as RSV. RSV is a very contagious virus that infects the lungs. RSV is a common cause of cold-like symptoms for all ages, but is often more serious for babies and young children. RSV can cause pneumonia, which can be deadly, especially for babies. Fortunately, babies can now receive RSV-fighting antibodies either from you, if you get vaccinated against RSV during pregnancy, or from an antibody shot after birth. Talk with your doctor to decide which RSV shot is best for you and your baby.